My name is Ron Terrell. I'm a neurologist, and my specialty is in stroke and vascular neurology and intensive care neurology. Speak or use language. It's not so much that a person's confused, but to the outsider, it might look like they're confused, but in fact, they're having difficulty either finding their own words to express their very clear thoughts, or they don't understand a lot of what's being said to them. Sometimes it's the sudden onset of incoordination where people can fall down, they can't get up, they don't know why they can't get up. Sometimes they can't get up because they're weak on one side or the other. And sometimes it's a severe headache. That's a different kind of stroke usually. A severe headache is usually an indication of a bleeding kind of stroke, but by far and away most strokes are caused by a blood clot that stops blood from flowing. People that are most likely to get a stroke are usually the elderly, but no one is exempt from the possibility. Strokes occur in utero. It's because there is a host of reasons why they occur. But after 55 years of age, just because you're alive, every 10 years your stroke risk doubles. That doesn't mean that most people get strokes. Most people don't. But there's about 850,000 strokes to 900,000 strokes a year in the US. The most common kind of stroke is formed or is caused by a blood clot, and sometimes they have what we call small vessel disease. Those are about 85 to 90% of all strokes, but the other 10 to 15% of strokes are a bleeding kind of stroke. The most common of those is called subarachnoid hemorrhage. For better or for worse, I get to see people in sometimes life and death situations, certainly life-changing situations or possibly life-changing situations. It's frightening. We don't have all the cures in the world, but we do have therapies that make a difference, and the biggest challenge is to get to people on time and for people to be aware of those stroke warning signs that I was talking about, so they know that when anything like that happens, that they come running. They call 911. That's what they should do. Whenever someone has a sudden or abrupt onset of a neurologic deficit, loss of neurologic functioning, those things I was talking about, that's the sign of a stroke. And they need to get in because we have treatments where we can try and clear out the blood clots, and it makes a huge difference when we get to people within the first 90 minutes of their symptoms, but still a big difference in the first 3 hours and even 4.5 hours. For almost all right-handed people and most left-handed people, the left side of the brain is where language is controlled. So people can have very clear thoughts about what they want to say, what they're seeing, what they feel, but the machine that turns those thoughts into symbols, words are symbols, they represent something, breaks down.
I am Carly Fleming, and I'm a speech language therapist. It's very rewarding to see them grow over time and find new ways to communicate and know that they can have success and that they can find new ways to communicate. What I find challenging, that would be when those words just get stuck inside their head and they're trying to get them out. And I'm trying all different ways to help them figure out the new pathway to get to that word. And we can't always get there, which is fine. We just have to be patient. But I want to help them communicate the best I can. So when we can't get there, I just feel that.
Strokes on the left side, the dominant hemisphere, and that would make it very challenging to return to work of any kind. It's also about the loss of strength that they might get or loss of use of their right arm or leg, but that language thing is huge. On the right side, people get this syndrome that we call neglect. You can be in stroke recovery for a lifetime, and that's why they talk about stroke survivors. Awareness of what a stroke is, our biggest challenge, and we're a lot better now than we